Hi, I'm Kelsey Jenson, and I'm a physical therapist here at Olmsted Medical Center. I specialize a little bit in neurology, so I work with patients that have Parkinson's disease or MS or have had a stroke. And I also specialize in lymphedema and geriatric care. My favorite thing about being a physical therapist is just getting to work with patients in the community on a consistent basis. I frequently will work with patients for a long span of time, over a course of months or even maybe up to a year at a time. So I really get to develop good relationships with the patients and their families, as well as their support systems. And I also really enjoy working with an interdisciplinary group here at Olmsted Medical Center. I work closely with our speech therapists, our occupational therapists, social workers, primary care doctors, and other specialty doctors. And I just really enjoy that interaction and trying to help the patient as a whole, not just one part of what they're coming in for. Usually when a patient comes in to see me, especially for the first time, I just want them to know that, first of all, we're working as a team. So it's not just an all me or all you activity. We're working together to set goals to make your life better and to improve things. And so I want to know a lot about you, and I want to know how I can help to make your life better and what you're struggling with right now in terms of function and ability. And so I ask a lot of questions as far as that goes. And we really work together to set goals that are pertinent to what you're trying to achieve at home outside of physical therapy. Some of the things that I feel grateful that Olmsted Medical Center has let me participate in or help develop are some different specialty areas that we offer here. And so I work with patients that have had Parkinson's or MS, multiple sclerosis, or have just had a stroke. And a lot of those times we need to be a little bit more consistent with physical therapy and have you come in quite regularly. And so we have some different programs if you've gone through any of those types of things or if you have any of those diagnoses. We also have a Parkinson's group therapy class that we offer every week. And that's been something that's been really fun for me to be able to get to work with people, and patients have really enjoyed because they're in a group setting, which is a lot of fun. I also teach Tai Chi, which is a lot of fun too. And that's something that is available to community members. You don't have to be an active patient, but I feel like I'm doing something proactively because it's meant to target fall prevention. And so we're trying to strengthen people before they have an injury or before they have an accident. And then I also specialize in lymphedema care. So if people are having issues with swelling in their legs or arms, we can help quite a bit with that in treatment here, and then also recommendations for future care. One of my favorite things here, being a physical therapist, is my ability to have time with my patients so I can make a good connection with them and really get to know them. So we have sometimes more time with patients than primary care providers or than a nurse or someone in the hospital would have with our patients. And that's really a gift because we get to connect with our patients on a little bit higher level and really get to know them and work with them through whatever problems they're dealing with at that time. Outside of work, I enjoy being really active. So I play a lot of sports and stay active with that. I'm active in my church community and with music. And all of those are good outlets that kind of go right along with being a physical therapist to keep me healthy and to keep me both physically and mentally, and also to just enhance my life a little bit more outside of work. I really enjoy coming into work at Olmsted Medical Center just because our patients are awesome. They're local. We get to know them well. And our coworkers are wonderful here. I feel so lucky to have been here for 12 years since I graduated from physical therapy school. This has been my first place that I landed, and I really love it. And it's just really nice to be part of a small community medical center that can do and offer so much, because I do feel like we have people with a lot of specialties and we can provide that, but also we have that smaller feel where I know most of the doctors and nurse practitioners and people that I work with and can talk to them. I feel comfortable with that. And I think that enhances the patient experience because we are really cohesive as a team and we can work for the betterment of our patients and just have a very smooth flow between departments here, which is really wonderful.